Hello, my name is Jamaal Jones, and thank you for visiting my YouTube page. I'm a healthcare attorney that practices in the state of Florida. However, in addition to Florida law, I often discuss federal law and programs such as Medicare and the Patient Protection and Affordable Care Act. I have a background in managed care litigation, but I focus my practice in transactional and regulatory work for individuals and corporate entities. Therefore, I consider myself to be a corporate transactions healthcare attorney. As such, I review, revise, and draft contracts, agreements, and documents for newly created or existing healthcare providers that will govern their relationships with other healthcare entities, business associates, or individuals. The essence of what I do is to provide you with legal advice to help your business stay within the bounds of the law and, more importantly, to help grow your business. With that being said, I am a lawyer, but I am not your lawyer, unless you are presently retaining my services through a retainer agreement. This YouTube video is not intended as legal advice. It is purely educational and informational, and no attorney-client relationship shall result after viewing this video. Please consult your own attorney for legal advice. If you do not have one and would like to retain my legal services, please contact me using the information listed below. Today, we're going to discuss telemedicine and mobile health apps and wearable tech and how they all kind of intersect with each other. There was a time when you could receive a home visit from your primary care physician when you were feeling ill. Well, those days are long gone, or are they? Much like many other aspects of our lives, the delivery of medicine has evolved throughout the years, and we're now being ushered back to the days when we didn't have to travel to our physician's office to receive medical treatment. This time around, when the nurse says the doctor will see you now, the visit will be very different. The proliferation of telemedicine has made the delivery of medical services more accessible to those who are unable or unwilling to travel to their physician's office. Our busy schedules or physical disabilities resulting in immobility has increased our demands and usage of telemedicine. Now more than ever, physicians and their patients are utilizing mobile health applications and wearable tech devices that collect, store, and transmit our protected health information, or PHI, to our physician or any other healthcare provider or entity that the patient designates. When the physician receives the patient's PHI through the app, the physician can interpret that information to provide her with a more accurate examination during the next telemedicine appointment. In other words, telemedicine and mobile health apps and devices, when used in tandem, allow physicians to provide a more precise diagnosis. Technology is meant to simplify our lives, but at what cost? We've all seen and received advertisements that state, "Stay focused this holiday season with the latest in wearable tech. Get real-time heart rate and calorie burn stats." To the average consumer, wearing a smartwatch or using a health tracker app on your phone seems harmless. But what happens when your PHI gets into the wrong hands? What if there is a data security breach and millions of PHI, including yours, is stolen by hackers? What if a provider discloses your PHI to someone that you did not authorize them to disclose it to? The reality is that this occurs more often than we'd like to admit. And with the increase in the usage of telemedicine and mobile health apps and wearable tech, we are more susceptible to our PHI getting into the wrong hands. The popularity of telemedicine for healthcare providers is increasing rapidly because it allows providers to connect with and treat a larger populations of patients than it otherwise wouldn't have access to. And the result is an increase in profits. New laws are being enacted and existing laws are being revised or amended to facilitate the surge of telemedicine. Generally, telemedicine involves the use of interactive telecommunications for the delivery of healthcare services, when a healthcare provider and patient are not in the same physical location. Telehealth and telemedicine are two phrases that are commonly used interchangeably. Engaging in this practice of remote healthcare allows providers to reach more patients and grow their business by providing healthcare services such as primary and specialty care and remote patient monitoring via video conference rather than requiring patients to travel to an office or hospital. Although the use of telemedicine is utilized sparingly compared to the face-to-face treatment by a healthcare provider, its use is on the rise, and laws and regulations are being enacted across the nation to govern the provision of telemedicine by healthcare providers. Telemedicine policies regarding reimbursement, licensure requirements, online prescribing, scope of coverage, and other issues vary greatly from state to state. Several states have or are in the process of enacting legislation that address several of these issues. Florida, like many other states, has been slow to enact new laws or evolve existing laws and statutes to deal with the proliferation of telemedicine. On March 12, 2014, the Florida Administrative Code established standards for telemedicine practice. This rule was adopted by the Florida Board of Medicine and the Florida Board of Osteopathic Medicine. The rule defines telemedicine as the practice of medicine by a licensed Florida physician or physician assistant, where patient care, treatment, or services are provided through the use of medical information exchanged from one site to another via electronic communications. Florida does not have specific language within its statute nor its administrative regulations, granting out-of-state physicians a limited license to enter the state remotely to practice medicine, but that may change if proposed legislation is passed. For example, an insurer using a provider that's in-network in another state would also be allowed to treat a Florida patient if passed. The rule prohibits the use of telemedicine to administer healthcare services by using solely an audio-only telephone, email messages, text messages, or facsimile transmission, U.S. mail or other parcel service, or any combination thereof. The rule also states that the standard of care must remain the same regardless of whether a Florida licensed physician or physician assistant provides healthcare services in person or via telemedicine. Florida licensed physicians and physician assistants providing healthcare services via telemedicine are responsible for the quality of the equipment and technologies employed and are responsible for their safe use. The rule did not include a list of technologies that it deemed safe for use in telemedicine. This was done on purpose to allow the rule to be broad enough to permit the practitioner to use available technology sufficiently encrypted and compliant with HIPAA. Physicians may not prescribe controlled substances through the use of telemedicine unless the patient is in a hospital facility. According to the rule, prescribing medications based solely on an electronic medical questionnaire constitutes the failure to practice medicine with the level of care, skill, and treatment which is recognized by reasonably prudent physicians as being acceptable under similar conditions and circumstances, as well as prescribing legend drugs or other than in the course of a physician's professional practice. Under the rule, physicians and physician assistants cannot provide treatment recommendations, including issuing a prescription via electronic or other means, unless a documented patient evaluation including history and physical examination to establish the diagnosis for which any legend drug is prescribed, b, there has been a discussion between the physician or the physician assistant and the patient regarding treatment options and the risks and benefit of the treatment, and c, there exists proper maintenance of contemporaneous medical records. Patient confidentiality obligations and record-keeping requirements of physicians and physician assistants are not altered by the provision of healthcare services via telemedicine. In fact, a physician-patient relationship may be established through telemedicine. This rule does not apply to emergency medical services provided by emergency physicians, emergency medical technicians, paramedics, and emergency dispatchers. Additionally, the rule doesn't apply where a physician or physician assistant is treating a patient with an emergency medical condition that requires immediate medical care. Now let's turn to reimbursement for telemedicine. While this rule accomplished a lot for establishing standards of care, listing licensure requirements, and online prescription prohibitions, it did not mandate insurance coverage or reimbursement for telemedicine services provided in Florida. There are many factors that states use to determine the scope of coverage for telemedicine applications, such as the quality of equipment, type of services to be provided, and location of providers. The American Telemedicine Association tracks recent changes to state telemedicine legislation, including those states that have enacted legislation mandating private insurance coverage for telemedicine services. While there are several bills before the Senate and House in Florida, there remains some skepticism by various parties in interpreting and expanding upon current telemedicine regulations. In Florida, if passed, there's a Senate bill which would require public and private insurers to reimburse for telemedicine services, allowing doctors to negotiate payment rates with insurers. Supporters of this bill and others believe that in the long term, telemedicine will save money by reducing hospital and emergency room admissions. Now we look at federal healthcare program payers such as Medicaid. According to Medicaid's website, telemedicine includes such technologies as telephones, fax machines, and emails, which are used to collect and transmit patient data for monitoring and interpretation. Even though such technologies are not considered telemedicine, they may nevertheless be covered and reimbursed as part of a Medicaid coverable service, such as a laboratory service, X-ray service, or physician service. For a provider to be reimbursed for the delivery of Medicaid covered services via telemedicine, those services must meet federal requirements of efficiency, economy, and quality of care. Federal laws afford Florida the flexibility to develop novel payment methodologies for telemedicine services. For example, states may reimburse a physician or other licensed practitioners at the distant site and reimburse a facility fee to the originating site. States are permitted to reimburse for technical support, transmission charges, and equipment. These add-on costs can be incorporated to the fee for service rates or separately reimbursed as administrative costs by the state. If they are separately billed and reimbursed, the cost must be linked to a covered Medicaid service. Medicaid guidelines require all providers to practice within the scope of their state practice requirements. Some states have enacted legislation that requires providers using telemedicine technology across state lines to have a valid state license in that state where the patient is located. A provider must have a Florida license to conduct telemedicine across state lines into Florida. The provision of healthcare services is generally held to be where the patient is located, so that the standard of care in the patient's community should, but may not always apply. Existing state malpractice case law, tort law, and civil procedure will govern telemedicine issues in the absence of telemedicine-specific statutes. As for Medicare, on July 7, 2015, the House introduced the Medicare Telehealth Parity Act of 2015, which, if enacted, would increase the scope of telemedicine services covered by Medicare. Specifically, this bill would lessen the originating site requirements for certain services, expand the types of services that are covered to include services such as respiratory services, audiology, and outpatient therapy services. Expand the types of providers whose services are covered, expand the geographic locations in which telemedicine services are covered, and establish coverage for remote patient monitoring for certain chronic conditions. The bill would allow reimbursement under Medicare for certain services provided in a beneficiary's home, regardless of locale. As it stands today, Medicare Part B pays for the office or other outpatient visits. Subsequent hospital care services with the limitation of one telemedicine visit per 3 days. Subsequent nursing facility care services, not including the federally mandated periodic visits under Section 483.40C, and with the limitation of one telemedicine visit every 30 days. Professional consultation, psychiatric diagnosis interview examination, neurobehavioral status exam, individual psychotherapy, pharmacologic management, end-stage renal disease-related services included in the monthly capitation payment, except for one hands-on visit per month to examine the access site. Individual and group medical nutrition therapy services, individual and group kidney disease education services, individual and group diabetes self-management training services, except for 1 hour of in-person services to be furnished in the year following the initial diabetes self-management training services service, to ensure effective injection training, and individual and group health and behavioral assessment and intervention services, and smoking cessation services furnished by an interactive telecommunication system if the following conditions are met. First, the physician or practitioner at the distance site must be licensed to furnish the service under state law. The physician or practitioner at the distance site who is licensed under the state law to furnish covered telemedicine service described in this section may bill and receive payment for the service when it is delivered via a telecommunication system. Second, the practitioner at the distance site is a physician, physician assistant, nurse practitioner, etc., as defined in the appropriate section of the Code of Federal Regulations. Third, the services furnished to a beneficiary at an originating site, such as a physician's or practitioner's office, critical access hospital, rural health clinic, federally qualified health center, hospital, skilled nursing facility, community mental health center, or critical access hospital-based renal dialysis center. Fourth, originating sites must be located in either a rural health professional shortage area or in a county that is not included in a metropolitan statistical area. Fifth, the medical examination of the patient is under the control of the physician or practitioner at the distance site. Now we take our focus away from federal health payers to private payers. Many private payer insurance plans do reimburse for telemedicine delivered services. However, federal law does not require these payers to provide coverage for any type of telemedicine delivered service. Some states have passed their own private payer laws, affecting private payer plans that operate in those states. Currently, 28 states and DC have some private payer related reimbursement laws. An additional 4 states have telemedicine private payer laws that have passed but are not yet effective. Some states mandate some sort of reimbursement, while others mandate reimbursement at the same level as in-person care under certain conditions. Now that I've given you a thorough background on telemedicine, let's turn our attention to mobile health and fitness apps and wearable tech. Not all mobile health apps and wearable tech are created equally. If the health app or wearable tech electronically collects, stores, and shares PHI with covered entities, i.e. physicians or business associates, in connection with a transaction for which the Department of Health and Human Services has adopted a standard, it must be HIPAA compliant. HIPAA privacy and security regulations extensively regulate the use and disclosure of individually identifiable health information and requires certain covered entities, including most healthcare app developers and their business associates, to implement administrative, physical, and technical safeguards to protect the security of such information. The HITECH Act promotes the adoption of meaningful use of health information technology. HITECH provides HHS with the authority to establish programs to improve healthcare quality, safety, and efficiency through the promotion of health IT. HITECH addresses the privacy and security concerns associated with the electronic transmission of health information, partly through several provisions that strengthen the civil and criminal enforcement of the HIPAA rules. Additionally, there are several federal agencies, including the Federal Communications Commission, or the FCC, that regulates the use of wearable tech. PHI is any information in a medical record that can be used to identify an individual and that was created, used, or disclosed in the course of providing a healthcare service, such as a diagnosis or treatment. Examples of PHI includes billing information, test results, doctor's appointments, scheduling, etc. HIPAA was drafted in an age when health apps and wearable tech were non-existent, and therefore protecting PHI in health apps was not a consideration in drafters' minds. As a result, it is difficult to determine when apps must be HIPAA compliant and which are exempt based on the current drafting of the law. Mobile health apps are not required to be HIPAA compliant if they are only used for tracking or informational purposes, such as those that track daily diets, allow the user to covertly research various illnesses, provides access to medical reference materials, and permits users to record their weight and exercise routines. To determine whether an app falls under HIPAA, the developer should determine whether the user will be a covered entity and if it will include PHI. If the app doesn't involve PHI or involve a covered entity, it doesn't have to be HIPAA compliant. Implementing the HIPAA privacy and security rules are indispensable to operating these apps because they are highly susceptible to data theft and other security breaches. When we consider the frequency with which wearable tech and cell phones are lost and stolen, we understand why it's important to be HIPAA compliant. App developers who believe that their apps must be HIPAA compliant can protect and secure PHI by incorporating the following safety mechanisms into their apps. First, you can require a password or other user identification. Second, you can allow users to enable built-in encryption capabilities. Third, you can allow for remote wiping and or remote disabling. Fourth, restrict file sharing applications. 5, enable security software to protect against viruses, malware, and spyware attacks. And 6, make sure that security software is up to date. This is not an exhaustive list, but just some of the security measures that an app developer should consider when adopting policies and procedures to protect PHI on wearable tech. App developers should require that all of their business associates agree to sign a business associate agreement. A business associate is a person or covered entity that performs certain functions or activities that involve the use or disclosure of PHI on behalf of or provides services to covered entity. This is true even if the app was not intended to be used in a manner that stores and transmits PHI. If an app collects and stores PHI intentionally or unintentionally, it must be HIPAA compliant. Stating that the app was not intended to collect or store PHI is not an adequate defense during a HIPAA audit. Healthcare providers are increasingly incorporating wearable tech and mobile health apps into their telemedicine practice. They should not access unsecure or unknown Wi-Fi networks when using this tech if it contains PHI. Securing wearable tech that stores and transmits electronic PHI is required by the law. I'd like to thank you for taking the time to look and listen to my YouTube video on telemedicine and its connection with wearable tech and mobile health apps. At the time of the recording of this video, all of the laws were current, but it may subsequently change. So you will want to consult with your attorney or myself, Florida-based attorney, for any additional questions or inquiries that you may have. Thank you for taking the time to look at my video.